Imagine living in a world where every day feels like an emotional roller coaster, where the highs are incredibly high, but the lows can be devastatingly low. Relationships feel intense, unstable, and every interaction feels like a potential crisis. This is just a glimpse into the life of someone who lives with borderline personality disorder or BPD, a condition that severely affects how a person feels, thinks, interacts with the world. Today, we're going to discuss symptoms, challenges, and treatments, as well as answer your questions on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage our viewers to send in their health question. I am Dr. Rachna Baksani Mirpuri, a licensed mental health therapist. Our first question comes from our own website, allhealthtv.com. Let's see who it's from. Pia writes, "Hey, Dr. Baksani, I'm not a big fan of my younger sister Prudence's boyfriend, Jack. He's impulsive, a mood swinger, and exudes an almost palpable fear of losing my sister. I read about borderline personality disorder, and I'm wondering if he may have some of the symptoms. Can you please explain them?" Pia, what a great start to the show, beginning with an understanding of what BPD or borderline personality disorder actually is. So let's get into it. These are the 9 traits that characterize borderline personality disorder. The first one is an intense fear of abandonment, and that fear can be real or perceived. Now, the reason I say real or perceived is because it's not actually happening, but it's what they feel is happening. So if someone's in an argument with another person and the person just exits the room, they can perceive that as an abandonment. So it's an intense fear that someone's going to leave them. A pattern of unstable relationships. So of course, the relationships are as intense as they are. So it can start with being really intense and loving, and oh my gosh, it's all about that person. And then very soon, move to the angry, I'm fighting about everything, I'm just mean. It really does feel like you're on a roller coaster. Identity disturbance. People with BPD actually struggle with having a sense of self, right? So I've often had my clients come and tell me, I really don't know who I am. And they really don't know who they are. And this can result in them changing their hair color, changing their name, moving places just to be able to figure out who am I, right? Because they really have the loss of sense of self. Impulsive. People with borderline personality are extremely impulsive. They really act without thinking, and their actions are really a way of soothing their emotions. So when I'm feeling that intense emotion, if I'm feeling fear, if I'm feeling anxious, I am going to do something to soothe that. And in the process, I might commit actions that are very impulsive. The next one is what makes BPD actually really dangerous, because there's a high rate of suicide attempts amongst individuals who struggle with BPD. The suicide attempt could be a way of stopping a person from abandoning them. So if someone's going to leave the relationship, their partner with BPD is going to try to stop them. And maybe one of the ways that they're going to do it is by, okay, but I'm going to hurt myself. And then that results in the partner feeling compassionate or feeling vulnerable and saying, no, don't worry, I'm not going to leave you, right? So really, even that is a way of preventing that abandonment. However, sometimes those suicide attempts can be successful, which is why this particular point makes BPD extremely dangerous. Frequent mood swings, and this is where BPD often gets confused with bipolar disorder, right? So we see people with BPD having frequent mood swings. So I can be anxious, I can be happy, I can be sad, all in an hour, right? Which is where it's different than bipolar, because when bipolar, if someone has bipolar, they have mood swings, but those mood swings do not happen as frequently as in a day, right? So someone who has bipolar is going to be depressed for X amount of time or number of weeks and then have a manic episode for X number of weeks or sometimes months. Whereas borderline personality, you're going to see those mood swings in a day, in an hour. Feelings of emptiness, they have a hole that cannot be filled. And the whole life of a person with BPD sometimes is spent trying to fill that hole with the love of people or the affection of people, but it's just something that they're never able to get to that point that they feel fulfilled. Difficulty managing emotions, it's really hard. They feel such emotions so intensely, whether it's anger, whether it's happiness. And they can become, if in those states of anger, they can actually become verbally and physically abusive when they are triggered. So they have a real difficulty in managing those emotions. And in the extreme case, we see individuals with BPD actually experiencing symptoms of psychosis or disassociation and paranoia. Again, those are the extreme cases of BPD, and sometimes just even those symptoms, because it's not actually psychosis, but it seems like it's so a psychosis because there's so much into within themselves and in their minds. Hope that helped answer your question. Let's move on to the next one because this is such an important topic. I know there's going to be lots of questions about it. The next question comes from Izzy. And Izzy writes, Dr. Baksani, how is borderline personality disorder diagnosed and what role does a mental health professional play in this process? I'm asking because my ex-wife and I went to counseling, but to no avail. When we stopped going and finally called it a day, the therapist pulled me aside and diagnosed her with BPD. She's still the mother of my kids, and I want her to get help. Izzy, thank you for being so thoughtful, being compassionate, and being what sounds like an amazing ex-husband and a really proactive father. Let's talk about what role mental health professionals play. So yes, borderline personality disorder is diagnosed by mental health professionals. And the way we do it is we assess symptoms, we assess behavior in therapy, and we also conduct personality assessments. Now, here's the challenge. Because personality assessments are long, they're expensive. Not a lot of therapists actually engage in giving these assessments to people, which is what makes the diagnosing of BPD extremely difficult. So sometimes it's months before a therapist actually realizes, oh my gosh, this person came in with anxiety, but actually there's something else going on and it's a personality disorder. But yes, mental health professionals are the ones who will help diagnose. Hope that answered your question. Let's move on to the next question, and that comes to us from Flora. Hello, Dr. Baksani. As much as it pains me to say this, my husband Nathaniel and I think our son Lane has BPD. Assuming that's the case, what are the main treatment options available for BPD and how effective are they? Lovely question. And yes, Flora, they are treatment options, and the gold standard for treatment of BPD is dialectical behavior therapy. Dialectical behavior therapy, which was a brainchild of Marsha Linehan, who struggles with BPD herself. So it's a lovely treatment, focuses on 4 major components: mindfulness, emotional regulation, distress tolerance, and interpersonal skills. So these are the 4 components of dialectical behavior therapy, which is actually conducted in individual and group settings. We can also have trauma-focused treatments that's found to be very helpful because usually people with BPD have suffered some sort of trauma in their life. So any of the trauma treatments are great. And of course, last but not the least, there are medications. We can use mood stabilizers that can be helpful to help people with BPD regulate their moods. Lovely questions. In case you missed it the first time, here's another opportunity to find out where you can send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Let's see what our next question of the day is and who it is from. This question comes to us from Serena. Hey, Dr. B, I just started a new job and 3 of my coworkers have warned me that my new boss has borderline personality disorder. If that's indeed true, and I can't see why it's not, what are some common triggers for individuals with BPD? Serena, my heart goes out to you. I'm sure this is not easy. Remember, unless you know for sure there's a diagnosis, just take everything with a pinch of salt. But in case it is actually true, here are some of the triggers that can set them off. And remember, it's a very individualized disorder, so it's not, there's no one formula that fits all. But these are some of the common things that we see. Firstly, anything that can create a sense of abandonment. So if you are in a meeting with your boss and you decide to walk away without a whole spiel of why, what, when, that's going to be, that's going to create a sense of abandonment, and that's not going to be taken very kindly. Even being silent and not responding can be sometimes taken as abandonment. So be careful and be mindful of that. They do not take criticism well at all. So be mindful of that too. Even if it's constructive criticism, you probably want to stay away from that. Some topics can be triggering, and now this is challenging because there's no way you're going to know what exactly those topics are, but the topics that trigger their trauma might be extremely triggering for them. Again, if you know something about a past trauma, stay away from those topics. And most importantly, mind your tone, because they are hypervigilant. If they sense a tone that is condescending or dismissive or contemptuous, oh my gosh, no, that's a big trigger. That's not going to work for them. And even if you don't mean it, so be extra mindful of your tone when you are addressing your boss in meetings or otherwise. Hope this is helpful, Serena. All the best with what is, I'm sure, a very challenging situation. Let's move on and see who the next question is from. Forrest. Dr. Buksani, I just started dating a new woman, Maxine, after being in a long-term relationship. She's very attractive, very exciting, and very intense. I'd like to take things slow, but she seems to be all in after only a few months. Unfortunately, this is kind of a red flag for me. And I'm wondering if Maxine might have borderline personality disorder or histrionic personality disorder. It sounds like they're all the same. Wow. Forrest, I am so excited for this question because yes, they are so confused, and rightfully so, because here's what happens. There is a lot of overlap between the disorders that we find in cluster B. That's why the DSM actually clustered them together. And these are the cluster B disorders. So we have histrionic and we have narcissistic, we have borderline personality. All of them kind of sit in the same place and thus share symptoms. Let's see how you know though how we can distinguish between borderline and histrionic. So first, off the bat, histrionic people do not panic because of a sense of abandonment, right? They don't have a fear of abandonment like the BPD folks do. As we've discussed in a couple of questions, the most, I think, prevalent symptom for a person with BPD is that intense fear of abandonment. Histrionics do not. They don't experience that. So that's one very big distinguishing factor. The other thing is that while both engage in attention-seeking behaviors, they're for very different purposes, right? So for a borderline person, when they are seductive or they are attention-seeking, they are doing it because they really want to hold on to this person for dear life. They don't want to be abandoned. They don't want to be alone. They want a meaningful relationship no matter what it takes with this person. On the other hand, though, with a person who struggles with histrionic personality disorder, they are purely doing it to get attention, right? So it's not because they want to have a close relationship with one person or people. They're just doing it for attention. If I had to really put it in one line, a BPD person needs a partner, a histrionic person needs an audience, right? So that's how they're different. Because for a histrionic person, if they're not getting attention from one person, they're going to move on. They're going to go to another person. If they're not getting attention from there, then they'll move on. There aren't any feelings attached over there. They just really want attention. Versus a person with BPD, they really want a meaningful relationship. They want to feel loved. They want to fill that hole, right, of emptiness that they feel. Hope this has brought a little clarity on this very confusing topic of the cluster B disorders and how they are different. Let's move on. We have a question from Facebook. Malcolm asks, hey, Dr. Baksani, my loved one seems to have BPD. How can I support them while at the same time not lose my mind? Lovely question, Malcolm. I am both stressed or concerned that you are in this relationship, but really happy you're reaching out. And I love your compassion to want to help your loved one through their struggles. So let's talk about some tips of how you can navigate this challenging relationship. The first one is, please accept that this is a difficult relationship. Offer yourself compassion. You're not going to get it right all the time. There's going to be moments that you're going to feel like, oh my gosh, I'm on a roller coaster ride that I really didn't ask for. What is happening? So please offer yourself compassion. As far as your loved one is concerned, try to be as consistent and predictable as possible for them. Because remember, if you're not consistent, or one day you're quiet, but the next, because maybe you've had a difficult day at work, they might perceive that silence as abandonment or rejection, and that might really set them off. So you want to try to be as consistent, as predictable as possible with them. Encourage the individual to seek treatment. So please encourage your loved one to seek treatment, to approach therapy. And remember, for a person struggling with borderline personality disorder, therapy is a lifelong process, right? So they might need to be in therapy for the rest of their life, but that's the way they're going to be able to navigate all the intense and the challenging emotions that they're feeling all the time. Seek out therapy for yourself. Please take care of yourself. This is a difficult situation to be in. So please reach out to a therapist, tell them what you're struggling with. Get a therapist who understands personality disorders and who's worked with them. But please seek out therapy for yourself. Manage expectations. Remember, even if your loved one gets into therapy, are they going to be changing overnight? No, this is a process. It's a process that even in therapy takes years before we see some sort of leveling or managing skills. And even then, they're going to have those triggering moments. So please manage your expectations of how soon your loved one is going to become okay. Educate yourself, which is what these shows do, right? Listen to people, read up. There are excellent books out there on borderline personality disorder, living with someone with borderline personality disorder. So please educate yourself as much as possible on what that relationship looks like, what to expect, what not to expect, how to take care of yourself. And last, but by no means the least, is please set boundaries, healthy boundaries for yourself. Do not tolerate abusive treatment. That is only going to enable your loved one and get them to do it more and more, to the point where it's going to become hard for you, and the only respite is going to be walking out of that relationship. So really, if you want to be in this relationship and navigate it, make sure you set those boundaries and call out when your partner is being abusive. Hope that was helpful. If you've got questions, we've got answers. And just in case you missed it the first couple of times, here's yet another chance for you to find out where you can send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Our next question is from Instagram, and this time it's from Sophia, who asks, Dr. Buxani, my partner has BPD. I've been hearing about the concept of splitting in BPD, and can you explain this to me a bit more? What a fantastic question, Sophia. And a really misunderstood concept, but also because it's so confusing and so unnerving to understand this. So let me try to explain to you what splitting is in BPD, right? So a person with borderline personality disorder really looks at the world in black and white, right? So there is no gray. And they also look at people in black and white, and there isn't a gray over there. So one day I could be the best therapist in the world. Oh my gosh, you are God, you've saved me and you've done everything for me. And then the first time I disappoint my client with BPD, oh my gosh, you're the worst. It's because of you that my whole life is ruined and my family, and I don't believe that I came to you. I'm going to, inundate you with bad reviews. So that's how fast, and all of that can literally happen in a session. So they can walk in singing my praises and they can walk out really hating me. And that is the concept of splitting. So the idea that I'm going to actually put someone on a pedestal and worship them and talk about how good they are and everything that they've done, and oh my gosh, you mean so much to me, and all of that. And then maybe in a couple of days, or in a couple of hours, or in a couple of weeks, I'm going to take that person and throw them down on the floor. And now you're a terrible person. You're not, you don't mean anything to me. You're evil. You're a disgrace, right? So now what is confusing about this is because the partner who's in this relationship with a person with borderline personality disorder is going there thinking, what just happened? Because yesterday or an hour back or last week, she or he was in love with me and I was the best thing that had ever happened to them. And now I'm this crazy worst person on the face of the earth. What is happening? And how do I navigate this? So this concept is the concept of splitting that we see in most, if not all, patients or people who struggle with borderline personality disorder. I hope that explained it a little bit as we are navigating again, as you're navigating probably a very, very challenging situation. Let's take our next question. And that comes to us from Momar. Momar says, hi, Dr. Buxani. Can you discuss the role of emotional regulation in BPD and strategies to improve emotional stability? I love this question, also because I love the techniques of mindfulness. So I'm going to talk about that in explaining what is the role of emotional regulation, right? So remember, as we've talked about individuals with BPD, one of the things that they really, really struggle with is those intense emotions. The idea that I'm on a roller coaster because and everything that I feel is so intense and I need to soothe it immediately. So I'm going to run and do whatever I can. And sometimes those actions are not very adaptive actions. So we, as part of dialectical behavior therapy, and actually a lot of other therapies now, we use mindfulness techniques to help our clients who struggle with BPD to be able to regulate, right? So in that moment when I'm feeling that intense emotion, instead of reaching out and doing something impulsive, let me see if I can move from my emotional mind to my wise mind, right? So my emotional mind is where all my emotions are sitting and I'm going like, I don't know how to deal with this, to where I'm like, okay, hold on. I don't need to act on this right now. Let me breathe. Let me calm myself down and think about what do I need to do in this situation. So that's what emotional regulation helps us to do. And the way we do it is through mindfulness techniques. Meditation is one fantastic way of, achieving that mindfulness, but there are other ways too. There's journaling, lovely ways of achieving mindfulness. And mindfulness is probably one of the most important techniques we have out there to be able to help us regulate. Lots of meditation apps available nowadays for free, or some are subscribed for. Please subscribe to any of those meditation apps and help your loved ones, if they're struggling with BPD, get on a meditation routine to help them regulate emotionally. And once they regulate emotionally, they wouldn't then engage in either self-harm behaviors or behaviors that are harmful to their relationships. Hope that's helpful. That's all the time that we have for today. I am Dr. Rachna Baksani Mirpuri. We'll see you the next time on Ask the Doc.
Send in your questions to questions@com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.